March 11th, 2020, exactly 2 years ago, marked a watershed in the pandemic. That was the date that the World Health Organization declared COVID-19 a global pandemic. That day marked the beginning of a pandemic that has changed the way we lived for the past 2 years, with more than 6 million lives lost around the world and counting. Back in 2020, our guest tonight, Dr. Ezekiel Emanuel, a physician and vice provost of the global initiatives at the University of Pennsylvania, published "Which country has the world's best healthcare?" An extremely timely question. And now an updated paperback edition is set to come out this month. Dr. Emanuel, thanks very much for joining us on this sad anniversary. But I think you're the right guy to talk to. I think you're the right person to talk to because of the way you were already looking at a global response. For the paperback release of your book, for instance, you've updated it with some lessons to be taken from countries' responses to COVID. So what larger lessons stand out to you 2 years on from the start of the pandemic?
Well, the first thing is being prepared is really important. And countries that did well, like Taiwan, were prepared. Taiwan, experienced SARS in 2003, and they did not want to have another case like that. They hired epidemiologists. They hired infectious disease specialists for their public health agency. They bolstered their data infrastructure so that they were monitoring and doing much better surveillance. Another thing that we think is important is central control and collaboration, so that there is a task force or some other group across the government that can harmonize and coordinate the response. After all, the response is not just the health agencies. It involves the Defense Department. It involves labor, education, taxing authorities, allocating resources. There needs to be a point of contact with the private sector, the pharmaceutical companies making vaccines, making therapeutics, making tests and other diagnostics.
But in your new edition of the book, you say, quote, "The epitome of a poor response may be the United States." And I think it's one of the things we're all asking. We're a wealthy country. We're a medical powerhouse. What happened?
Well, we often take an emergency, we get past it, and then we just ignore things. And we're past that, let's move on. And that move on attitude without investing in the future is what turns out to be a real problem. And we're poised to do the same thing now. We just had Congress pull out $15 billion allocated to pandemic response, COVID response, when we should be investing $100 billion for that response to build up the infrastructure, to develop new vaccines, new therapeutics, have a surveillance system that's 21st century and electronic. This is like defense. And the second is that it's an investment. If we invest now, we can forestall and minimize the impact of future infectious pathogens and their threats.
And we learned in some ways how divided, how broken in some ways our society was. Is that really one of the reasons, maybe the main reason, that we got the death toll, we're approaching 1 million now in our country, that we did?
Well, certainly the political polarization, the massive misinformation campaigns have contributed to many people dying. And that doesn't even mention the other burdens that society has had to shoulder, the economic loss and the impact on families who've lost their homes, didn't have enough to eat, lost jobs. We need to do a much better job. And you're 100% right. Again, one of the key elements of countries that did well, high social trust, high social agreement. We haven't had that.
Got to build it back up. You're also one of the authors, Doctor, of a new report out this week titled "Getting to and Sustaining the Next Normal, a Roadmap on Living with COVID." So that's interesting, the next normal, rather than a return to pre-pandemic life. What's that going to look like? What's most pressing for us to reach that goal?
Well, one of the reasons we call it the next normal is that it isn't, as you point out, 2019. Certain things should be better. First of all, we have an mRNA vaccine platform that is going to make making vaccines much better, not just for COVID, probably for flu and other things. Second, we should markedly increase our indoor air quality, because that's how these viruses transmit. And if we actually invest in that, it can be better and not the same thing. Similarly, if we invest in surveillance, we can have early monitoring of potential outbreaks, so we can take preventative measures, whether it's improving the air quality, wearing masks for a short period of time, protecting the vulnerable populations. It requires recognizing, to get past COVID, we actually need to focus on some of the defects that COVID has revealed in our public health system, our buildings, and in many other parts of society.
Dr. Emanuel, thank you very much for joining us, Emanuel and Ezekiel, and thanks for the new paperback edition of your book, the edition of Which Country Has the World's Best Healthcare, by Dr. Ezekiel J. Emanuel. Be on sale on March 22nd, wherever books are sold. Thanks for joining us.
Thank you. My great honor.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.